And I believe the member for Melton has the call.
Great. I shouldn't have sat down. Thank you, Deputy Speaker. I feel very honoured to rise today to speak to the Workplace Injury Rehabilitation and Compensation Amendment Provisional Payments Bill 2020. I would like to thank the Minister of Workplace Safety in the other place and her dedicated staff for bringing this legislation before this Parliament. I would also extend my thanks to the previous Attorney-General, the member for Altona, on her work on this bill, and of course the member for Frankston for his work on the pilot committee. The Andrews Labor government takes the mental health and wellbeing of Victorians seriously. Our commitment to mental health, Royal Commission, and our response is testament to this commitment. I think all of us here in this place are fully aware that many of Victorians' mental health and wellbeing has been through a challenging time during this pandemic, and of course the bushfires at the beginning of last year. We as a community have had it tough, and many of us have faced challenges that can take its toll on our mental health and wellbeing. The Andrews Labor government has provided support for Victorians through this pandemic and has treated mental health with seriousness that is needed. We have seen included at the budget in December $868.6 million to ensure Victorians have the mental health support they need as our government has got on with fixing a broken system. The budget funded the rollout of the interim recommendations from the Royal Commission into mental health, including $492 million to deliver 120 mental health beds. $18.9 million was allocated to provide for 35 acute treatment beds for public mental health patients in private health services. And of course, $152 million to support and provide mental health services in a direct response to the COVID-19 pandemic. This government knew that it was important to prioritise mental health and wellbeing with challenges not seen in Victoria for 100 years. This government, of course, knows that we can't just stop there in prioritising the mental health and wellbeing outcomes for Victorians. That's why this bill will deliver on our 2018 election commitment and introduce a provisional payment scheme for mental injury medical expenses in the Workplace Injury Rehabilitation and Compensation Act 2013. This government is also is well known for its commitment to the workers of Victoria, and I'm so proud to see multiple pieces of legislation brought before this House that has sent a clear message that Victorian workers are valued by this government. I've spoken on a number of those bills that this government has introduced to protect Victorian workers. They include protecting workers from wage theft as well as work safety. I was proud to contribute to the workplace manslaughter legislation last year, and I spoke extensively about my experiences as a paramedic dealing with the aftermath of some devastating scenes of workplace accidents. I spoke then about tragic scenes I ran into at the Sims Metal explosion in Brooklyn in 1986. During that contribution, I described how as paramedics we were directed towards a man who was squatting down, not a stitch of clothing on, his skin hanging off him. He was conscious and amazingly he was alert. He had sustained 80 to 90% burns to his body. I can still smell the scent of his burning skin. Scenes like this is something that many of our frontline emergency services have or will encounter. I have no doubt that it can adversely affect the mental health on workers. The nature of the job is that in an emergency, you get on and do what is needed to be done, but only later can the effects begin to take its toll. These types of situations our emergency services frontline workers deal with for us can be incomprehensible to those who don't experience it. They are called emergency services because that's exactly what they do. They serve our community. That service often comes at a price that is not just economic. During my time representing my members at the Ambulance Union, I've seen many examples of the mental health of that my members have suffered due to delayed or deliberate stalling of accepting a mental health claim. I've seen injured paramedics make mental health work cover claims and still be waiting for many months for that claim to be accepted and treated for treatment to commence. This delay in treatment does complicate the injury made and more difficult for the worker to return to work. We are unfortunately all too familiar that statistics for self-harm, suicide and PTSD can be significantly greater in frontline workers. I know that mental health impacts on my members can intensify when their government doesn't have their back. We saw it through each Liberal national government that treated their hard-working emergency service workers poorly, and when they undervalued our emergency services, the impact that can have. I've stated it many times that it was my ambulance union members that were a big part of why those opposite lost government, as Victorians lost confidence in them in 2014. The low morale of emergency services forced us to fight for improvements that only Labor governments deliver for workers. It's an Andrews Labor government that prioritises our emergency services along with all Victorians. And it's this government that continues to deliver on our commitments, this time delivering a provisional payment scheme for mental injury medical expenses. This bill is designed to help injured workers get support sooner and get back to work quicker. This is so important. I know some of what my members would go through and some of the mental trauma they could be exposed to. We have to make sure that our workers in this state get the help that they need as soon as possible. Making sure that workers get the support they need and get back to work when it's safe to do so. It's not just an economically sensible thing for everyone, it can also help so much mentally if an affected worker gets the support they need sooner. I'm pleased that this bill will seek to ensure earlier access to mental health treatment and support workers and eligible volunteers with a work-related mental injury. It is so important to have a proper plan that assists with the recovery to be able to return to work. We all know the impact mental health can have, and if harm has been done to someone through their work situation, then of course it is time that that damage is recognised for what it is and dealt with quickly, like any other harm that could occur to a worker. We have seen the mental injury claims have grown significantly in recent years and are expected to account for a third of all workers' compensation claims by 2030. I think that this is a good sign that finally, as a society, we aren't hiding away mental health concerns under the carpet and hope that they will disappear. It's a positive change when we can recognise that our mental health can suffer at work and we should do something about it. We know that the nature of mental health claims can be more complex and take longer to determine than physical injury claims. If you break an arm at work, then you know about it. Sometimes recognising the emotional and mental harm has occurred can be more complex, and then assessing that can add more time to getting treatment. Currently, it can take up to 38 days for a worker's mental injury claim to be determined. This can limit the ability of some workers with mental health injuries from getting access to treatment quickly. I know of workers who have been uncomfortable seeking help. It can take some courage and effort to admit that you need some help sometimes. When there is a delay in assessing a claim, that can make the situation worse, or it can cause some people to not even attempt to seek help in the first place. Unfortunately, I can think of too many people in my industry that never sought the help they should have had. We must make sure that time delays for a claim don't prohibit workers from seeking help and support. And I'm very pleased to see that this bill seeks to address this by providing a provisional payment scheme covering costs such as GP visits, psychiatrist or psychologist appointments and medication. This provisional payment scheme removes the financial restrictions that can delay workers getting their care they deserve. This bill will change the current system and will mean that work cover insurers will have only 2 days to assess a worker's eligibility to these provisional medical and like expenses for mental injury claim. This is coupled with a new notification requirement of 3 days, ensuring employers are passing on the details to work cover as soon as possible. And I'm pleased that this bill builds on the government's successful provisional payments pilot for emergency service workers and volunteers, which was launched in June 2019. Once again, this is another example of how our emergency service workers know that this government values them and their work. Through this pilot and through what frontline workers have known for some time now, we've seen how important it is for those frontline workers to be able to access support for medical expenses as soon as it is needed. This bill ensures that all Victorian workers and eligible volunteers will now all be able to benefit from these important changes. This is, of course, a government that listens to workers and employers, and the design of these reforms has involved extensive consultation with unions, employee groups, injured workers, legal and medical representatives. Sometimes for someone to seek help, it can be a challenge. A worker might be reluctant to seek the help that they need because they could be unsure whether their claim will be accepted. Mental health harm isn't always as clear as a wound or a broken bone. Having provisions in this bill that allows workers to seek and receive help, even if their claim could ultimately be rejected, is an important reform. It ensures that a worker will continue to receive access to payments for medical and like expenses for up to 13 weeks from the date they lodge their claim. This provides workers with some certainty to ensure immediate support whether or not their claim is accepted. This will encourage workers to make a claim and get the support they need. This is an important change for Victorian workers and hopefully leads to better health outcomes for all of our community. I hope this goes some way to reducing the stigma that some still have towards mental health. I'm proud to be part of a government that seeks to make it easier for workers to put their hand up for help when they are struggling. I support these reforms and I commend the bill to the House.